One of my favorite Grey's Anatomy quotes spoken by Meredith Grey is, "On average, our hearts beat 70 times per minute. In that same 60-second period, we blink between 10 and 15 times, swallow once, and take up to 20 breaths." Our hearts beat, our lungs breathe, our bodies keep us alive. And most of us barely notice. We just take it all for granted. Today I will be talking to you about the evolution of pediatric heart surgery. I believe that I can tell you this speech and topic of heart surgery because last year for my History Day project I did pioneering open heart surgery, and so I have learned a lot about heart surgery last year through my research for that project. I also want to be a surgeon. I do not know what specialty I want to go in yet, but cardiothoracic surgery is one of my options that I am considering. The main pieces of information that I'll be talking to you about today about pediatric heart surgery is the first successful pediatric heart surgery today, and heart surgery in the future. Starting with the first successful pediatric heart surgery. The first surgery was in November 29th, 1944, and it was performed on an infant that had a heart defect called tetralogy of Fallot, also known as blue babies. This heart defect was found in infants and babies. There was no hope for a cure, so they commonly died because they had not enough oxygen to keep up their systems running and get enough air. The surgery that these doctors performed was called the Ballock-Tossing shunt, and it was to increase the oxygen levels, and they did that by connecting oxygen-rich and oxygen-deprived blood vessels. The surgeons that performed the surgery were Dr. Alfred Ballock, and his assistant was Vivian Thomas, and they revolutionized the care of this cyanotic child with construction of the subclavian artery, and they used end-to-side anastomosis. And anastomosis means a cross between adjacent channels, tubes, fibers, or other parts of a network. So this surgery helped create pulmonary blood flow, and they published their experience in 1945. I found some of this information from an article called Johns Hopkins Medicine and History of Pediatric Heart Surgery 2018. So the pulmonary, these are pulmonary valves, and the blood pumps through those valves to the heart. So that's how you get your oxygen and blood and all of that. Now that I've talked about the first pediatric heart surgery, I will now move on and talk about pediatric heart surgery and heart surgery today. Heart surgery has evolved immensely, whether it's better techniques and tools or more understanding of how our bodies function and what they need to function, and physiology, and with all of that combined has helped doctors and surgeons to have better outcomes in their surgeries. The first surgery I am going to talk to you about is a non-surgical intervention surgery, which is actually the same surgery. They're doing the same thing as they did for the first successful pediatric heart surgery, but they are using it a safer way, and they are repairing the pulmonary valve, or they're implanting it so then they have enough oxygen. And this surgery, the way they do it, will help reduce the number of times that the family and patients have to risk open heart surgery. This surgery is done by inserting a catheter into the femoral vein, which is guided by an X-ray. And once the graft is in, it should work and function right away. I found this from Technology and Future of Heart Surgery, and this was published in 2019. Other surgeries that are done today that are heart surgeries by doctors and surgeons are such as repairing or replacing heart valves, which is just like this. Again, and these are all different heart valves. And they are important because they control the blood flow that we need to get to our heart so we can breathe. Repairing abnormal damaged structures, implant devices to control the heartbeat, heart donation, and they can even treat heart disease and heart failure. That I got from Medline Plus Heart Surgery, and that was published in 2020. Now that I have talked about heart surgeries today, I will now move on and talk about heart surgery in the future. Doctors and surgeons are working to create 3D holographic visualizations that can be touched, marked, and manipulated during the surgery, and then hopefully creating them so they can perform the surgery using them. So they can see what's inside and what they need to do better. They have also talked about creating 3D bioprinting cells that can eventually grow into a heart valve. That will help tremendously with heart donation, as now you have to wait for a donor, and they have to be your match, whether it's your blood type and whatnot. And so that process can take a while, and sometimes you don't even get a new heart or heart donation surgery. Today, I hope you learned some new interesting facts on pediatric heart surgery through the first successful pediatric heart surgery, pediatric and just regular heart surgeries today, and heart surgery in the future. Heart surgery has grown tremendously since the 1900s, as there have been new machines and tools that have helped the doctors to see better and to have more steady work and more information they know about our bodies and what they need to function. Relating back to my quote from Grey's Anatomy of how our hearts beat, our lungs breathe, and our bodies keep us alive, I hope that you will now think back and just think about how everything in our bodies is going right and how they just are alive and everything is working, even on the days that things aren't working, such as you having a cold or the flu, that your body is still trying to fight against those, and they are working. They're just infected with something, but then they are working at the same time to fight the disease and get you back to your normal health status. Thank you.